All right, we're rolling. All right, Dr. Gary Hiding, citing an AOA study, stated that 5 to 10% of all preschoolers and 25% of all school children have vision problems. I know personally, like the guys on the team, Swank and a couple other guys do need corrective lenses to be able to see, to do schoolwork, hit the ball, just walk around, be functional. I see all the time my friends on Facebook posting pictures of their kids with glasses, like wandering eyes, like lazy eyes, stuff like that. And you wouldn't think it would bother you, just it's a job, you're kind of hanging out working for an eye doctor, but it does. You see it all the time and you're like, take your kid, get an eye exam, get them treatment, get them help. It'll help them with their development. Basically what we're going to try to do today is I'm going to try to help you understand the importance of an eye exam for kids and just anyone in general to develop as a person both mentally and their sight. Let's look at how an eye exam can make a child smarter. Early detection. 80% of development for a child is through their vision. You would think a lot of it's going to be through hearing stuff and feeling stuff, but realistically it's through vision. Because to start out with, kids don't talk. Like they can hear their parents' voices, but most of their stuff is going to be tracking the person as they walk around, that sort of thing. The American Optometric Association recommends that the first eye exam for a child be at 6 months of age. The doctors that I work with do this. It's called an infancy exam. Basically, they come in, they'll manually test the pressure of the child's eye by touching their eyes. They may not dilate them, sometimes they do. It's hard to do on little kids. They're not super cooperative. But they'll try to check the health of the inside of their eye. And they'll also do what's called retinoscopy, which is checking the refractive power of their eye to see if they need corrective lenses to have good vision. The next exam they recommend is at 3 years of age and then before they go into kindergarten. Just so that if they do get to school and they can't see, they have the glasses so that they can learn things. I mean, that's where your development, your biggest growth is from 3 to 8 years old when you're in school. Most kids can pass a vision test. Like at an eye doctor's office, looking at that chart, most kids are going to read 20/20, but they may still need glasses. The 20/20 chart only is going to check your distance vision. It doesn't check your near vision. And a lot of kids, it's more common for them to have problems with their near vision than it is for their distance vision. The frequency of the exams, if they have an exam when they're 4 or 5 years old going into kindergarten, and they do need glasses, their exam frequency should be every year. They should have an exam every year because their eyes are going to change rapidly, and the doctor needs to be able to keep up with it so that the child can have clear vision so that they can learn. If they don't need glasses, every couple years is fine, just to make sure that nothing's going on and they don't have any health issues. Now that you know when the exam should take place and why, we're going to talk about the different eye diseases the doctor can find. Early detection is critical to treating eye diseases in children. There are a couple different diseases, well, quite a few actually, but most of them are considered like adult diseases like cataracts, glaucoma, and then there are different retinal disorders. Some of them are inherited from your parents, some of them just kind of develop over time through trauma or what have you. Cataracts in kids are rare, but they do happen. We actually had a family of kids come in this year to one of our offices, and 2 of the 3 kids in the same family had congenital cataracts, which are just like an inherited thing that they were born with. And the cataracts just obstruct their central vision. The detection allowed our doctor to refer them out to a child specialist who can remove the cataracts, replace the lenses in their eyes, and allow them to see clearly. Another eye disease generally associated with older people is glaucoma. The American Optometric Association says that 1 out of every 10,000 kids born in America will be born with glaucoma. People don't realize the severity of the disease, but glaucoma.org said it's the leading cause of blindness in America. And it's a degenerative disease. It doesn't start out, you don't just go blind one day, but just as it progresses, you will go blind. We've also had a few cases of that in the practice that I work in this year. Retinal disorders can also be detected by checking the health of the eye, by through dilated exams and opening up the front of their eye so you can see inside. We had a kid this year that was 12 years old that has had yearly eye exams from the time he was 5 years old. One of our doctors couldn't figure out why his prescription wasn't changing, but his vision was declining. Actually diagnosed the child with retinitis pigmentosa, which is an inherited retinal disorder, and basically the kid's gonna go blind. There is no choice about it. The child will go blind and will probably be blind before he's 20. But through the diagnosis by the doctor, it allowed the kid to seek help, like getting larger print books for school, and getting counseling to help them cope with the fact that they're going to go blind. There are, however, cures, or at least effective treatments for another common ocular disorder called amblyopia. Amblyopia is generally referred to as lazy eye. The American Optometric Association estimates that 2 to 5% of the U.S. population has lazy eye to some extent. Most people think of lazy eye as just like your eye wandering around. That's generally what they think of for lazy eye. That is called strabismus. That means the muscles in your eye just aren't strong enough to hold your eye in place and help it track. There's also refractive amblyopia, which just means that your brain has kind of shut off signal to that eye, and it's just not pulling in information the way it should. If diagnosed early and treated, both of them the effects of them can be diminished. You can create so that the eye will track, and you can make the eye pull in information. The most common method is patching. There are a couple other methods like eye muscle surgery for kids, but the eye muscle surgery, it corrects the problem you see, but it doesn't correct the actual vision problem. The eye muscle surgery just kind of holds their eye in place. It doesn't actually correct the vision problem. We have 4 doctors in the practice that I work with that are vision therapy certified and that work with kids to correct amblyopia. To conclude, eye exams are important. They give children the best chance to have good vision so that they develop properly and so that they can learn everything they need to. Obviously, guys in this room and guys on the team in general do need corrective lenses to be able to see, to do classwork, walk around, strike a tennis ball really, really well. When's the last time you had an eye exam? You definitely need to make sure you stay up to date. It's not just about being able to see, it's about the health of your eyes as well. And according to the American Optometric Association, 20/20 vision does not actually denote perfect vision. It denotes average vision. The best recorded vision ever was 28. Thank you for listening, and my audience for today's speech were 3 guys from the men's tennis team. I'm not sure. Sam, Andrew, and Thomas. Thanks, guys.
Thanks, Dave. Appreciate it.
Good job.